I'm Wendy Stimpson, physical therapist and creator of the GyroCoach. Today I'm going to demonstrate how to use real-time visual biofeedback tools to teach and to restore motor control. Teaching motor control can be best achieved by using an external focus. Visual feedback from laser pointing devices can provide this. The GyroCoach generates two laser lines so that both you and your patient can observe three planes of motion. The patient is able to restore motor control by controlling the motion of the light lines. Change in the range of motion can be measured in real time by using the line lengths as a reference. When using laser technology to teach hip external rotation, a single point laser can be used for visual feedback. The patient is able to see the motion at one segment but is not able to determine if another body segment is contributing to the motion. In this video, the patient is observing the motion of the femur. When using one laser pointer, it is not possible to differentiate the motion occurring at the femur from the motion occurring at the pelvis. Two cross-beam lasers can be used to illustrate the motion at the hip and provide a visual measurement of hip external rotation. In this video, the patient is wearing a 20-degree angle laser on her pelvis and a 45-degree angle laser on her distal femur. The 45-degree vertical line is starting at the top of the horizontal line on the target. The patient has been asked to keep the short crossbeam still as she moves the large crossbeam up the target. The total hip external rotation achieved is the difference between the motion of the 45-degree or long vertical line and the 20-degree or short vertical line. In this video, both the therapist and the patient can observe short crossbeam motion of 10 degrees and long crossbeam motion of 55 degrees for a total of 45 degrees left hip external rotation. As the patient practices this motion with the laser lines as an external focus, she will learn to externally rotate the hip without pelvic motion. Hip motion can also be observed in weight bearing. In this video, the patient is wearing a single point laser on her distal femur and a 20-degree angle vertical line on her pelvis. As the patient steps up, the motion of the single point of light illuminates femoral rotation abduction. The vertical line in the pelvis indicates whether or not the pelvis moved contributing to the observed femoral motion. Hip strength deficits can be differentiated when the patient is wearing a crossbeam laser on her distal femur. In this video, the patient is wearing a 45-degree vertical line on her pelvis and a 20-degree crossbeam on her distal femur. As the patient steps up, if the crossbeam moves towards the vertical line in the pelvis, then the patient is internally rotating her femur with gluteus maximus deficits. If the crossbeam tips towards the vertical line, then the patient is adducting her femur, demonstrating gluteus medius deficits. The patient can increase gluteal strength functionally by performing the step-up while controlling the laser line motion. Laser-based visual feedback can be adapted for most exercises. In this video, the patient is using a leg press to control femoral rotation. Rather than looking at his knee, he is using the external focus of the laser lines on the ceiling to control femoral rotation. As the patient improves hip control, the laser pointing devices can be used for more complex motor patterns. Patients can observe femoral motion when performing a weight shift from double leg stance to single leg stance. A single point laser can be used on the distal femur to observe and control motion. When using a single point of light, the therapist and patient are not able to differentiate if they are observing hip rotation or hip ab or adduction. Observing gluteal deficits can be best achieved by using a line or crossbeam laser. As with the step-up, if the line moves without tipping, the patient is rotating the hip. If the line tips, the patient is abducting or adducting the hip. These observations can be used to assist with developing the optimal exercise program for each patient. If a crossbeam or horizontal line is illuminated, the degree of internal rotation can be measured. In this video, the 20-degree angle horizontal line is positioned so that one end of the line begins at the center line on the target. As the patient shifts his weight to his right foot, the horizontal line moves across the target, the length of the line. This indicates that the patient is internally rotating his right hip 20 degrees. As the patient performs repetitions controlling the motion of the line, he is able to recruit the gluteus maximus and reduce femoral internal rotation in weight bearing. When two lines or crossbeams are the laser sources, it is again possible to differentiate between hip rotation and hip abduction. The patient and the therapist are able to observe pelvic motion as well as to determine if all the motion seen is due to hip deficits or if pelvic motion is contributing to the observed rotation. If the horizontal line is illuminated, the difference in motion can be measured. Internal rotation adduction of the hip is a common functional deficit seen in rehabilitation and sports. To achieve true hip control, all of the joints contributing to the motion must participate in motor control training. It is possible to use 3 laser sources to observe if there are substitutions at the pelvis or the foot to compensate for hip weakness. In this video, the patient has a long vertical line in his pelvis, a short vertical line on his distal femur, and a short horizontal line on the ball of his foot. The patient has been asked to not move the long vertical line or the short horizontal line as he shifts his weight onto the right foot. He has been asked to keep the short vertical line along the outside line on the target. If the long vertical line moves, then some of the appearance of femoral control could be from pelvic rotation. If the short horizontal line tips, then the patient may be substituting foot supination for gluteus maximus recruitment. This series of weight shift videos were all part of one physical therapy session. The patient was able to progress from 1 light source to using 3 light sources and achieving improved control over his right hip femoral internal rotation without foot or pelvic substitutions. The patient will be able to practice recruiting his gluteal muscles functionally and restore a normal gait pattern. This laser technique can be used as a part of any patient's program to teach the patient to perform exercises and functional